Hi, I'm Scott Burris. I'm a professor of law and public health at Temple University.
And I'm Jennifer Ibrahim, Associate Professor and Associate Dean in the College of Public Health at Temple University.
So Jen, we just published a study in the Journal of Public Health Management and Practice that looks at 29 years of NIH funding to see what proportion of NIH grants were devoted to evaluating the impact of legal interventions. What do you think the most important part of the study is?
Well, I think the most interesting takeaway was over this course of time, what we found was that there's only 1/4 of 1% of all NIH funding that has been allocated to look at legal evaluations of laws. And so we know that public health laws are an innovative and cost-effective way to elicit behavior change and to improve population health. And yet at the same time, we're spending such a small amount to actually generate an evidence base to understand how these laws are influencing us.
That's striking when I think of how much time and effort and money goes into testing the effect of drugs before we even give them to people and then monitoring them afterwards. And yet we'll pass laws that apply to the entire U.S. population and never study whether they work or not.
And I think the other thing that we saw where funding was being allocated was looking at tobacco, at alcohol, more recently starting to see an uptick in obesity. So I think there are some trends where there's what is the hot topic, what is the popular health issue that's being studied. But as you mentioned, Scott, there are many more legal interventions that we should be looking at. So we have an evidence base to understand what's working, what's not working, and what laws might be misfiring and we should go back and reconsider.
So we know we need NIH to spend more money to support more timely evaluations of new laws to see whether they're having their desired effect. I think it would also be important for us to help as educators train more people in public health and law to become evaluators in this space and to build careers that NIH can support.
Mm-hmm. And I think as well as having those researchers who are well prepared to do the research, also encouraging NIH to ensure that they have the appropriate expertise on the study sections. And so as these grants are being reviewed, they're being reviewed by folks who understand what is a strong empirical legal evaluation.
One more thing I'd like NIH to do at the National Library of Medicine is to create mesh terms that actually allow us to track more easily the public health law research. In our study, we had to plow through nearly 10,000 grants that came back when we searched simple terms like regulation and law, because we were getting back studies that were about the regulation of cell growth and Boyle's law. There are no mesh terms that actually capture public health law research or legal epidemiology, the evaluation of law for scientific purposes.
Absolutely. So hopefully this article and advocacy from the public health law research community, hopefully in the next 29 years we'll be coming back and it'll look very different.